Welcome back to Living Local. Joining us today, we have our friend Lori Miller. She's an independent insurance agent here in the Lowcountry. Thank you so much for hanging out with us today. It's been a while.
Thank you for having me. Yeah, it has been a while.
Okay, so 2021, there's some changes as always. I feel like you come every time and have a different thing to educate us about. But today, before we get into the changes and the things that we need to think about, just give an overview of what you do.
I am an independent insurance agent, and I specialize primarily in the senior market, meaning Medicare, life insurance, long-term care, things like cancer policies, heart attack policies. But the biggest component, I would say, would be Medicare-related things.
Okay, when it comes to Medicare, how does one know they even need it?
Well, typically, the vast majority of us are going to end up on Medicare at age 65. Possibly earlier if we are disabled for at least 24 months. But it is going to be, for 90% of the population, your primary insurance from 65 through the rest of your life.
Okay, so, you know, a lot of times there's all these misleading ads and things like that, and it can just stress you out. You don't even want to deal with insurance, but it's an important thing that we all need. How do you kind of help navigate people through that?
Right. What I like to do is come from a point of education. So before we ever talk about insurance, even if somebody's been on Medicare a while, I like to start with a Medicare 101, just with them. And everybody, every single day says to me, I feel like I'm reasonably intelligent, but I'm so confused by Medicare. And doctors and lawyers and accountants and bank presidents and hospital administrators, they all say the same thing. Medicare is a very confusing system. So I like to start with, let's just learn how it works and the pros and cons of it. Then we start talking about insurance needs.
And that's what I love so much about you, because you're willing to look at someone straight up and just say, you have a good situation here.
Exactly.
I'm not where you should go.
Don't mess with it.
Okay.
Yeah.
So how do you decide that when you're dealing with someone who has maybe an employer insurance and things like that? How do you walk
What
them
we
through
do
that?
is we try to get either a link to their benefits or a printout of their benefits so that I can do a side-by-side comparison as to their coverage and what it's costing them, what's coming out of either their pay or their pension, versus what will it cost them to be on Medicare and have a supplement or an Advantage plan. And Medicare does not cost the same for everybody because the premium is based upon your income bracket 2 years before you're eligible.
I didn't know that.
Yes. So there is a standard kind of a base premium, and for 2021, that's $148.50 a month for your Part B. Part A comes to us typically at no additional premium because we've been paying into it for 1 million years, right? Okay, but Part B, there's still a cost. For very, very low income people, the state or Medicaid may pay that premium for them, but for your lower middle class income bracket, it's going to be $148.50. But if you're in a higher bracket, you can pay quite a bit more. So we have to evaluate what is that person going to be expected to pay for Medicare, and then stack up those benefits and compare them side by side.
And you take that on as a challenge, right?
I do.
You're like, I'm going to do the best I can do.
Absolutely, because just this past week, I've had 3 different people that I did reviews for, and the coverage that they had access to was going to be better for them in their particular circumstance than going on Medicare.
Good point there. All right, so as far as veterans go, we want to take care of them.
Right.
How does that work?
Veterans have access to get additional dental, vision, and hearing most often by getting an Advantage plan, but that's tricky. If they are on TRICARE for life, they should not let any agent talk them into an Advantage plan. It's going to cause them more problems. But if they are not on TRICARE for life, and they just go to the VA for their health care and they get their medications at the VA, then they can, at no additional cost, have access to some really nice benefits.
Wow, all right. Well, of course, I feel like we can talk all day, but before we head out, as far as when it comes to long-term care, because that's something that people need to consider on many levels, How does that work?
Well, Medicare doesn't cover it. And so people don't think about that. They assume Medicare covers long-term care, and it does not. Medicare will cover the first 20 days of skilled nursing after a hospital stay of at least 3 days. So that's just designed to be a temporary rehabilitative situation.
Like that you're going to live, they're assuming after that 20 days, like that you're fine, or
that,
it's
yes,
not like
you're
hospice
going there for
or anything.
rehabilitation, physical therapy, occupational therapy. That's the only component of long-term care in people's minds that Medicare covers, okay? And that's not long-term care. And long-term care is very expensive, especially the traditional way that they used to do it. So now we have some creative ways to help people prepare for long-term care by reallocating some of the funds they already have in their retirement funds. Sort of like taking them out of the garage they're parked and take a portion of them and park them in a different garage.
So you've almost become like a financial planner too, somewhat.
Right.
I love that.
To a degree, yes. And it's often something that financial planners or advisors don't talk about too much because they're focused on the marketplace, okay? So it is sort of a unique little niche there.
Alrighty, anything else we need to know before we head out today?
It's confusing. Don't beat yourself up. And it doesn't matter whether you're new to Medicare, aging in, or whether you've been on it a while. It's fine. Just give me a call. We'll make sure that what you have is really what's most appropriate for you. And if it is, we're going to leave it alone.
And she means it, folks, right? Alrighty, thank you so much again for joining us today.
Thank you.
More Living Locals coming your way, so stay tuned. We'll be right back.